Today's July 3rd, 2024. We're at
Oncologist.
oncologist, and what's the other word in front of it that means blood study? He's both. He does the study of the blood and diseases and cancer. So today we're hoping to have the results.
Actual diagnosis, stage, and roughly how much it's spread.
And treatment plan, which
Hopefully.
I don't think they can give us without your blood work. We don't have that yet, but we're just hoping for some answers today. And we're here 30 minutes early.
Let's go.
Because I was trying to confirm. Let me show you all the reports, of course, so that you'll have everything. So first is the biopsy. That's I call the pathologist. I've been calling them since yesterday, but apparently the person was on vacation, so I talked to the other pathologist here. Let me show you first why I was trying to and why I'm calling and all. So first, this is your biopsy. So this is you, of course, Matthew, Mark, Hilton. This is on June 24. And Dr. Holly said, of course, we ordered a test. So it's a right submandibular mass. And so it shows that the biopsy is invasive, poorly differentiated carcinoma with neuroendocrine features. So it is definitely cancer. Now, if you say see comment, the comment here, the histology shows scant infiltrating, somewhat discohesive malignant cells in the nest and the background. It's just a description. Right. The malignant cell shows moderate pleomorphism, fine granular chromatins, again, moderate cytoplasm, frequent mitotic figures, and cell necrosis. They did the stains. These are the stains, positive for keratin and CK7, synaptomycin, and TTF, and weakly positive for P63, and are negative for this. These are just the tests that they ran through the biopsy. So they said this diagnosis includes either a high-grade neuroendocrine cancer, poorly differentiated squamous cell cancer with neuroendocrine features, as well as other common cancers with neuroendocrine differentiation. So clinical correlation is required and with additional investigation as indicated. So that's why I was calling them. And I'll go back to that. So let's go to your scan first. First, you have the neck. So in the neck, they said they could see this palpable abnormality or a mass on the submandibular regions, about 2.4 by 1.9 by 2.3 centimeter. No other definite soft tissue mass or enlarged lymph nodes. It's just there. Okay. Now you had a CT scan of the chest, abdomen, and pelvis. Chest, abdomen, and pelvis. This is you again. So this one, from the chest, the abdomen, and pelvis, they said first the heart. There's a mild coronary artery calcification, meaning the blood vessels in the heart. The coronary artery has a little cholesterol deposits in there. But there's a little bit of trace fluids, so nothing to be worried about that at this point. Then hilum, that's more in the side, the right side here. Right hilum, there's a lymph nodes there. There appear to be more confluent superiorly, and there is an encasement of the right upper lobe artery. So the artery there is encased by this mass or lymph nodes in this area. Confluent bulky right suprahilar. So that's kind of more in this area here, right? Suprahilar, kind of more a little higher here. Measures about up to 2.5 centimeters. So that's about an inch size. And mild right hilar lymph nodes measuring 15 millimeter. The right hilar lymph nodes also, there's another 20 millimeter there. And there's a left paraesophageal lymph nodes that's about 16 millimeter. In the lungs, there's an 8 millimeter nodule. And then the left also, and that's in the left. And then there's a 9 millimeter nodule also, and another one on the right lower lobe slice. And then there's two 4 millimeter nodules on the right lobe. There's also a few other smaller nodules, both lungs. So there's fairly nodules in both lungs. In the abdomen, there's numerous hepatic masses, so there are multiple liver mass. A dominant mass in the lower segment is about 3 centimeter or 3.17 centimeter. Another one on the left lobe is 6.2 centimeter. That's quite big. That's almost 2.5 inches. And then a middle left hepatic lobe mass was 4.4 centimeter. So that's about an inch and a half roughly. On the posterior segment, there's another 3.3 centimeter and a few smaller subtle lesions. The spleen, there's a large heterogeneous lesion in the spleen that's about 5.4 centimeter. And then the pancreas is normal. The adrenal glands is normal. Kidneys, there's oval lesions in the back of the right kidney up to 2.4 centimeter. Big lymph nodes in the right hilar area, encasing the right upper lobe blood vessel. A few scattered nodules on both lungs. Multiple liver metastases and splenic mass. Then mid to lower pole of the right kidney lesions, all finding are suggestions of metastatic disease. Then mild thickening of the colon, non-specific, which may relate to distensions of artifacts and infection. Let's look at the pictures just to give us an idea. So the best way to orient you is this one here. So what it means, this is you, of course, Matthew filled it. So this is the table you're lying down. That's your back, that's your front. We're looking from head to toe. We're going to slice you like a sliced bread, you know. The thing is, this is a mirror image, so this is the right side. That's the left side. Okay. So if you look at this, so this is your shoulder. And so as we go down, that's your lung, okay? The black one there. So that's your lung. And as we go down, so this is where kind of something is in this area. That's the one that they talk about supraclavicular area. And then that's the lung as we go down further. So this is blood vessels. That's the airway. That's the aorta. So this is the mass you could see. And it's that mass is kind of impinging on that area there. Okay. So that's the mass. Okay. There's another kind of there closely. So it's extending down. So that's the big one there. And then as we go down further, if you want to see the smaller nodules, I will do it, but I'm just going to this is the liver. And as you see this, you see that dark spot there. Normally it should be smooth, but these are the dark spots there. So, and then there's another one, that's big there, maybe a smaller one there, kind of smaller here. So that's the big one, big one. And then this is the spleen. Normally the spleen should be smooth like this also. And you can see there's a big one there. So that's kind of where we are. So the bad news here is one, it's cancer. Two, it looks like it has spread here, here, and liver. If we're saying this is lung cancer, it's already spread here and it's also spread in the liver. So unfortunately, it is stage 4. Now we still have to clarify there's two types of lung cancer, the small cell and the non-small cell. That's the first step. If it's a non-small cell, they're treated a little more differently than the small cell, but they're both treated with chemotherapy. But even with those treatments, unfortunately, if it's already stage 4, at least at this point, and I have to be blunt here, I know you don't like to hear this, but unfortunately, it's not a curable disease because it's already spread. What we're trying to do here is buy you time and control it for as long as we could. Okay. Now, so your options here are you have 3 options at this point. Option 1, of course, you could say if it's not a curable thing, I don't want to do anything. Let me be comfortable as long as I could enjoy whatever remaining left, and until you pass away. So that's an option. Just do nothing, make it comfortable. Hospice, of course, is an option there. I'm sorry. So that's one option. The other option, of course, is we could try to do some treatments. And when we say treatments, either you can do chemotherapy, But chemotherapy, of course, also have side effects. So whether it's worthwhile going through those and have more, side effects and all. The other option, of course, is that's why I was calling them, is the future of cancer treatment has been changing a lot. And so sometimes we may have to do more biopsy because there's not enough tissue there. Because sometimes we could do additional testing for this. This is what we do now. What we do is the tissue, we send them for what we call molecular test. And the molecular testing, they could analyze those and see if you have other treatment options available. Sometimes, if you're positive for it, sometimes you could be on immunotherapy, which is not a chemotherapy. Or the other is sometimes there are other pills, what we call them targeted therapy, that we could use, but we probably need more tissues to be able to tell. So, but if there's no molecular abnormalities there, then your only options are chemo or nothing. So these are all your options. That's why I'm
So it's
following the
like
pathologist.
surgery or cutting some of this stuff out is not an option, or
Not an option because where do you cut? You cut the liver, you cut the spleen, you cut the so you'll be chasing this. It's not going to really help you.
yeah.
If it's localized in one area, you can cut them out. But there's in the liver, there's in the spleen, there's also in the chest. You really don't have a lot of options.
Okay.
Radiation can help partly if you want, especially if those blood vessels is getting constricted. But you're not going to get radiation all over, like radiate here, radiate there, radiate here. So it's usually either systemic treatments or nothing.
Okay. Okay, well that's kind of a pill to
What
swallow.
what's the time
It's really
untreated and treated?
it's really hard because, of course, first of all, that's why we need some tissue to see how more to clarify a little bit more whether this is, a small cell or a non-small cell. That's the first question. If it's a small cell, that's more faster. Non-small cell are a little slower, but it's still. We don't know even if you have it in the brain. Normally, we'll also want to do a MRI of the brain to see if it's spread there. That's one. Two, if we do treatments depending on, let's say, chemo, it depends on some patients will respond to chemo, then it'll be longer, but some will not be responding to chemo, and then it doesn't really change much. So these are all dependent on all this, but it's of course not good because it's already spread.
Okay.
Any other questions? So my question to you is, what do you want me to do? Do you want me to try to biopsy it again and see? Do you want to, think it over? And that, I think, is probably your best way, is think it
maybe
over
just
before
let
making a
us
To
decision.
biopsy is to find out how fast it's spreading and
What type of cancer it is, and also whether there's other options available, like sending for molecular testing. So whether that tissue, they will send it for molecular test. It takes 2 to 3 weeks sometimes. Or the
and the
results.
other option would be another treatment other than chemo.
That's
You're
what
saying.
That's why you
but
want
there
to do
might
the
be
molecular
another.
test. See if there's other options. But if it's not, it's either chemo or nothing really. That's all your options.
and chemo's not gonna
It's not
fix
going to
it.
cure this. It may probably hold it off if it works or buy you time, but probably not a cure.
And we can't do surgery on any of it. You
No,
can't
because
take
it's already stage 4. It's already spread. We don't advise surgery. You'll just be going through a surgery that will put you more weaker and put you more, but it's not going to help you because, let's say, you remove the liver, you remove the lung, which one do you remove? And you're still remaining with other cancers. It's not like you can remove everything.
I don't know, we want a different answer.
Okay. I guess we'll just go home and contemplate this, but we'll probably want to do the additional biopsy if we can to,
Mm-hmm.
at least check to see if there's.
Okay.
I don't know if I'm signing on for like just start chemo treatment and stuff.
That's another option. You could, if you want to start some chemo, of course. Now, do you have any insurance? Because we have to authorize it.
No, not yet.
Even the genomic sequencing, I don't know if they'll accept, but we can try, because the genomic sequencing sometimes that's sent to a different laboratories. And so I don't know if they'll do it or not. I have to admit, I'm not sure. One of the suggestion, if you want to go through as another option, and this is up to you, I'll I'll be glad to help you as much as I could. But one of the options also, and I don't know, sometimes Intermountain can help you out. You know, they have a financial assistance. Would it be easier to see them? Because then, if they're willing to, they may be able to help. And I don't know. I'm just saying
Yeah.
that's another option to kind of see the doctor there in the Intermountain and see if they can help you out. Of course, you could also talk to, and I don't know again the situations you have. Sometimes they can put you on Medicaid or something like that, but those are, I have to admit, I don't know the rulings on it.
Yeah.
And sometimes they
Can
look
you
at
give us?
property, incomes, and all those things.
Will you give us a referral to an oncologist at IHC so
I
that
could
we can
ask them.
start that?
I
If
could
that's
ask
it.
them. Okay. I could just ask them, you know. Yeah. I can send them, and so I'll refer you to one, and then you'll just call me.
Okay.
I'll put here like a second opinion or something like
Sure.
that.
Yeah.
And I just
Okay. As I mentioned, it's kind of,
Do we want to do a scan of the head just to see if it's there?
I can order that if you want. That's why I'm asking you what you want me to do, because normally I'll order everything.
Let's do it.
Or do you want to wait until you've seen the Intermountain? And again, that's up to you.
We
Yeah.
don't. I don't know. I don't know.
I just don't want you to get buried with also with all the bills and all too sometimes. But I can order it. I don't mind. I'm just putting all this for you to, decide and all.
I don't know. I'm worried about my wife. I can handle all this. I don't know if it's saying I'm ready, but it's. I worry about my wife. I worry about my kids and my grandkids, and my mom assured me that they are all buildings and will remain buildings, and the buildings will make sure that everybody's taken care of, that I don't need to worry. And that my dad's gonna be waiting for me. I still don't know what my purpose of all this shit I've been through throughout my life has been for. I don't. All the times I should have died before, it's like, I'm gonna die a man and not a partial of one.
So no chemo.